Delighted to be back with you again. And we are absolutely delighted with our next two speakers on the programme. So we have Olivia Grech, followed by Nuala Donovan. And Olivia is talking about a subject very close to people with IIH's hearts, is cognitive function in people with IIH. And we've been so excited to see this work coming out of Birmingham. So if I hand over to Olivia, and really looking forward to this talk, Olivia. Thank you.
Thank you so much. And I am really honoured today to be able to present one of the studies that we've had going on in Birmingham. If I just get my slides up. So I'm actually a third year PhD student at the University of Birmingham. I work in Professor Sinclair's group, and I'm mostly, first and foremost, a scientist. So I'm usually in the sort of lab, looking at sort of mechanistic work. But I've been quite lucky to be involved in quite a lot of the clinical studies and trials that have been going on in Birmingham. And one of the exciting projects that I was able to get involved in was a study that we were looking at to assess cognition in people with IIH. So I'm hoping today to give you sort of a background into cognition and how long it's been recognised or not so in IIH, give you an introduction to the sort of study and what we did in the study to assess cognition, and finally sort of summarise some of our results. So you will have to excuse any gaps in my clinical knowledge as I'm not sort of medically trained, more on the science side. So what's obvious for a lot of patients in IIH is obviously the visual and the headache symptoms. But one feature that probably gets ignored quite a lot is the effects of cognition. But this is something that's been long reported by patients. So patients will often report issues with thinking, attention, memory, and this can often be described as a sort of brain fog, not being able to remember things, not being able to think clearly. But obviously cognition isn't something that's routinely assessed when you see your doctors for IIH. You aren't diagnosed and then someone starts cognitive testing. So it's something that's not often investigated in patients. There are also a few previous studies looking at this. There's not many other groups have tried to assess this in patients. So there's not much literature out there to advise us on what sort of cutoff points there are for cognition or what we should do to improve it. Unfortunately, there are a lot of other disorders and diseases which often coexist with IIH, so anxiety, depression, sometimes obstructive sleep apnea, so difficulties breathing in your sleep. And we're not sure what these coexisting diseases, what their effects might be on cognition, because we know that there's a link between cognitive impairment and depression. And finally, some of the previous studies that have tried to look at this in IIH have used the mini mental state exam. So this is a cognitive test, which is obviously often used for screening for dementia and Alzheimer's. So it only really picks up obvious changes in cognition and memory. And it's not very good at picking up subtle differences in our cognitive function. So this hasn't been a suitable test to really use in the IIH patients, and it's not detected any massive differences before. And so in our group, we wanted to take on board these comments from patients that they had issues with attention and memory and formally assess whether cognition is affected in IIH. And so the big aims and questions of this study were as follows. So first, we wanted to test, is cognition different in IIH patients compared to controls? And these were volunteers who had very similar characteristics to IIH patients. So they were similar age, they were also all female, and they had a similar weight. And we want to test both groups with cognitive tests to see if IIH patients performed any differently. Next, we know that weight loss can be therapeutic for some patients and can lead to a reduction in brain pressure. So we wanted to investigate whether cognition is changed after this weight loss and this improvement in pressure. We next wanted to look at whether a short-term reduction in pressure, and we did this by performing a lumbar puncture, can improve cognition. So directly after that initial sort of relief of pressure, is there any effects on the cognitive performance? And finally, we wanted to investigate whether there was any relationship with some of those coexisting diseases, so comorbidities, and cognition in patients with IH. Are any of these coexisting diseases also impacting the cognitive performance of patients? So to do this, we used the IIH weight trial, which some of you may be familiar with in Birmingham. So patients were recruited at baseline, and for IH participants, there were 66 participants in this study. There were clinical measurements taken, so a lot of visual testing. A lumbar puncture was performed to measure pressure in these participants, as well as lots of measurements of the comorbidities. So a lot of questionnaires about headaches, your quality of life, anxiety and depression. In some patients, obstructive sleep apnea, so that sort of disturbed breathing and patterns overnight were also measured. So we got a huge amount of data from these patients. And then we performed cognitive tests in these patients, again at the sort of baseline level. And I'll describe these further in the next few slides. We then took some of these participants into a subgroup study. So some participants then had a lumbar puncture, and this is thought to provide a short-term reduction in pressure because you're taking out the CSF and you're giving a little bit of relief from the pressure. And then we repeated one of the cognitive tests in this subgroup. Then all of the patients underwent a 12-month weight loss regime, and this was either a community weight loss diet intervention like Weight Watchers, or some patients went and had a bariatric surgery program. And then after 12 months, after either the surgery or 12 months of the diet, patients came into the clinics again. We had a lot of the clinical measurements repeated, and the cognitive testing was also repeated. So we have clinical and cognitive data from baseline and also 12 months after weight loss. And a lumbar puncture was also performed at 12 months to measure any changes in the pressure. We then compared this with controls. So as I've mentioned, these are healthy volunteers who don't have IIH, but they have very similar age. They're all female, and they also have a similar body mass index, so similar weight and height. So we can sort of see which factors are impacted by IIH. And for these participants, they had the same sort of thing. They had clinical measurements done. A lot of them were exactly the same as the measurements that will be performed in IH patients. The cognitive testing was also performed on controls. And we also had a small subgroup of control participants who actually volunteered to have a lumbar puncture and then repeat one of these cognitive tests. So very similar to what happened with the IH patients, but there's no 12 months follow-up. So they didn't have a weight loss intervention and they weren't measured again at 12 months. So this is just a baseline comparison. So how did we test cognition in these patients? We used 5 tasks, and they assessed different aspects of cognition. So one of the tasks, for instance, measured attention and executive function. And this is a portion of your cognition that's involved in planning, focus and attention, being able to perform multiple tasks at once, those sort of executive functions that are involved in long-term planning, like I said, multitasking. We also had a task which assessed sustained attention. So this is being able to concentrate or focus on a task for long periods of time. And one of these tasks also assessed sustained attention while there was a distraction going on. Working memory and short-term memory are quite similar, and they were also assessed. But working memory is something that is used where you have a short-term memory of information, but this information is used for decision making or behavior. And we measured during these tasks the reaction time, so how long it took for participants to react to the prompt on the screen, and also how many of these prompts and tasks that they got correct. And as a sort of example of how these tests went about. So this is the word span test, which is short-term memory. So participants were shown a long list of words, sort of one after another with one on a screen, and then the nurse would ask at the end for the participant to recall the full list of words. And then this is our sustained attention, so being able to concentrate for long periods of time. The participant will be told that the target number is number 3, and every time number 3 comes on the screen, they have to press the mouse. So they'll be given sort of dummy numbers where you're not supposed to respond, but you only respond on number 3. So what are the results? So at baseline, when we compared the performance in these cognitive tasks in IH patients compared to that control group, we found that there was a significant impairment in executive function. So this is the portion that's involved with planning, multitasking, focusing. And you can see the dots here are sort of the average time, and this is sort of the range of results. So in controls, you can see that they have a much faster reaction time during this task than IH patients. So the patients are reacting slower to the prompts. Also, in addition to a slower reaction time, we also found that in comparison to controls, participants actually got fewer of the tasks correct. So they answered less of these prompts correctly. So we're showing that at baseline, in comparison to control volunteers who had very similar characteristics, the executive functions impaired in patients. So what about when we provide a short-term relief from that pressure? So remember that subgroup of controls and participants who then went to have a lumbar puncture, and we repeated one task in these patients, and this was the executive function task, also assessed some aspects of attention. And we show that before the lumbar puncture, the reaction time is much higher than afterwards. So even just a short-term reduction in that brain pressure and that intracranial pressure can lead to an immediate improvement in executive function. So the lumbar puncture was performed, and sort of within 30 minutes, the cognitive test was repeated. And you can see a huge improvement, or certainly a statistically significant improvement in the executive function. You can see here, these are the changes in pressure in before and after. So this maybe hints that pressure has a role in these impairments in cognition. What about when we assess patients again after 12 months weight loss, when we see more of a long-term reduction in pressure? The pressure results from the lumbar puncture show that the pressure is reduced in these patients, but it's not sort of as short-term as an immediate lumbar puncture would be. So we find that performance in the attention tasks were improved. There's an improved reaction time from baseline to follow-up in attention. We also show that executive function is improved, and maybe we might expect this from the lumbar puncture results. But we also show that the working memory is improved in these patients as well. The number of tasks that they got correct improved in this task. So this is something really almost reassuring as well, to think that although there are some impairments in cognition at baseline, it's not permanent. And this is something that we've shown can be reversed with a treatment such as weight loss, which leads to reduction in pressure. So what about the role of some coexisting diseases, some comorbidities that are linked in IH? We looked at the performance in all these cognitive tests and sort of paralleled them with some of the clinical measurements that we'd made to see if there were any links between the cognitive performance and comorbidities. And we actually found quite a few. So we found that the headache severity, so how painful your headache was on the day that you performed the cognitive test, actually impacted your attention task performance score. This is quite important to show that on perhaps some days when patients are having a really severe headache, their cognition's made worse. We also found that scores which are used to assess depression and quality of life were associated with attention and executive function task performance. So depression may also be having a role on cognition in IH patients. And this is something that perhaps for clinical care we should be looking out for. Again, the obstructive sleep apneas, those changes in breathing during sleep, were significantly associated with working memory. And we found that at baselines, the worse your obstructive sleep apnea was, the worse your working memory was. And remember, this is the short-term storage of information for sort of decision making. But what was quite interesting was when we found that this improved at 12 months. So the obstructive sleep apnea got better, and this was associated with improvements in working memory. And we also found that the disease duration, so how long you've had IH, also impacted the executive function. So patients with newly diagnosed IH may not have cognitive problems that are as severe as people who have had it for a longer amount of time. And these results are really important, especially moving forward with this sort of research and how we can take this into clinical practice, is discussing whether we treat these comorbidities like obstructive sleep apnea or depression, whether treating these comorbidities could actually improve cognition. So if we treated the obstructive sleep apnea, could we improve working memory, and the same for depression? So really important to sort of note for future work. One of the important associations we found was executive function and the ability to perform visual field tests. So there are obviously a lot of visual testing that's involved in IIH, and clinicians often use visual tests and these sort of assessments to monitor the progression of IIH or also the improvement after treatment. But we actually found that there was a link between the ability to perform these visual field tests and executive function. So visual field tests are often unreliable. The results can sometimes be unpredictable. And this might actually be due to the impaired cognition and attention in patients. So we could look at whether cognition is impacting this as a monitoring score. So to summarize, the key findings of the study based on those sort of questions we wanted to ask were that cognition is affected in IH patients at baseline. And in particular, we found that patients performed worse on executive function tasks. However, we found that when we gave a short-term reduction in pressure by performing a lumbar puncture, that the cognition improved in patients. And in particular, we found that executive function was improved almost immediately after the lumbar puncture. We also found that these deficits and these defects in cognitive function aren't permanent. So we show that when patients lose weight and there's a long-term reduction in pressure, there's an improvement in cognition. And this was for executive function and attention, and also verbal working memory. So multiple domains improved. And we also found that cognition was linked with a lot of these coexisting diseases and characteristics of IH. And that perhaps if we treat them, or we could improve IH, or perhaps it's important to note these comorbidities in patients because it might be these that are impacting the cognition. And it's important to note that cognition may impact the ability and the reliability of visual field tests. So the main take-home messages are, as recommended from the group, that cognitive impairment should be accepted as a clinical feature of IH, and it's maybe something that hasn't been considered previously, despite patients reporting this. That changes in the cognition impair the ability to perform visual testing, and this is something that should be considered when we perform visual tests. Is this a reliable readout, or is it potentially impacted by changes in attention? But not to worry, because these cognitive deficits aren't permanent and they can improve over time with a reduction of pressure. And in particular, we showed this by a weight loss intervention. And finally, it sort of brings up again that point of treating comorbid depression, obstructive sleep apnea, and headache. So treating these various aspects of IH that could improve cognitive performance. And I'd like to thank firstly, the IH participants that are involved in these studies. As soon as I started my PhD and sort of learned more about how many clinical trials and how many studies we have in Birmingham, I was almost blown away by how willing the IH patients are to get involved in research. And it's really nice to have that sort of collaboration with patients, and to know that they're really involved in the research and they really support it. So I'd really like to thank the participants for being involved in this study in particular. There are a lot of people who in Birmingham who've been involved in this study and involved in the cognitive testing and the clinical testing, as well as all the analysis. So I'd like to thank everyone, and hopefully can answer some questions, but as I say, I'm not a clinician, so it might have to be a sort of loose recommendations.
Olivia, thank you so much for that talk, because I know from personal experience that the cognitive effects of IIH are really not recognised. And I know it's something that we see in the chat groups about people when they are unable to work, who are having to claim personal independence payments, that unfortunately the cognitive effects are just not recognised at this moment in time. So do you have any ideas about how we can change that?
I think this, so we published this data and we've been sort of trying our best to sort of share it within the science community. But I think it's really raising awareness. And I think, you know, sending this sort of almost as a recommendation to clinicians that actually this is something that should be acknowledged. You know, we've definitely shown that there's changes in cognition, and compared to healthy participants, that cognition is impaired. I also think it's important as well to sort of take note of how these comorbidities and these coexisting diseases can also impact this, and that if we maybe think of treating IH on a multifactorial level, you know, having sort of help for anxiety and depression, or help for even the headaches, we show that, you know, headache can have a huge impact on attention. If we can treat the headache, can we improve the cognition? But I think as far as getting this recognized, I think it's just trying to raise awareness of stuff like this, and also sort of encouraging future studies to hopefully show the same as us, that cognition is sort of impaired. But I completely understand I was quite amazed by how it wasn't recognized, and Professor Molan and Professor Sinclair have often said to me that patients will often report sort of brain fog, but I guess if it's not in a guideline document, then it's hard for the clinician to say, well, that's definitely because of your IIH, or it's just because you've had a headache today. But yeah, I think it's encouraging more research like this and sharing within the community.
Yeah, absolutely. And just for people with IIH out there, as Olivia very kindly did a lay summary, so an easy to read summary of the research paper, which is on the IIH UK website. We'll pop a link into the chat, but there's also a link on the website to the paper, the published research. And actually what some people have done before is to take that, print it off and take it along to their doctor's appointments, or send it in with their application forms for PIP and things like that to provide that additional evidence.
Yeah, that's a great idea, actually. It's quite nice to know that that's sort of being used as evidence. And
yeah, I'm just having a look in the chat facility. It's important for treating clinicians to be aware of this too. Weight management services, executive function is crucial for behaviour change. Excuse me, I'm losing my power of speech there. As the HOPE programme have made adaptations for this in their programme. So yeah, that's absolutely true. So yes, so it needs to be shared with weight management services as well. Just having a look through. Great info, thank you. Does anyone have any other questions for Olivia? If I can ask you to put them either in question and answer or in the chat, and I'll ask them. Okay, otherwise, an enormous thank you to Olivia for taking part today and for raising this important issue that I know is close to the hearts of so many people with IIH. An enormous thank you from IIH UK and everyone with IIH for this piece of research. Thank you, Olivia.
Thank you so much, and thank you for the opportunity to share it today and supporting a lot of my research. I really appreciate it.
Lovely. Thank you, Olivia.